Welcome back, Stranger Than Fiction family, and welcome back, YouTube. This is your boy Antonio coming back at you with another video. Today, we're going to take a look into the disease that put me in the situation that I am in. The disease is called Mucormycosis. According to Wikipedia, it is also known as black fungus. I'm guessing that's why they call it black mold. It is a serious fungal infection that comes under fulminant fungal sinusitis, usually in people who are immunocompromised. It is curable only when diagnosed early. Symptoms depend on where in the body the infection occurs. It most commonly infects the nose, sinuses, eyes, and brain, resulting in a runny nose, one-sided facial swelling and pain, headache, fever, blurred vision, bulging or displacement of the eye, proptosis, and tissue death. Clearly, that's not where it affected me at all. Had nothing to do with my sinuses or headaches, none of that. It says, other forms of disease may infect the lungs, stomach, or intestines, and skin. That's where mine comes in, is skin. It is spread by spores of mold of the order Mucormycosis, most often through inhalation, contaminated food, or contamination of open wounds. So, I had road rash on my back, which would be considered the open wound where this disease infected me. I also had where the doctor, if you can see kind of right here, I don't know how well the camera's picking that up. Let me turn on my light. See if we can get a better view of it here. If you can kind of see, and I have pictures, like I said, I'll post at later dates, later video. But my head was split open here, but also right in the top of my head, right around this area, there was another very small cut, and I have pictures of it also. Well, my wife does. It was a very small cut, and that's where it infected the top of my head. Okay. Where was I at here? Okay, so it says, these fungi are common in soils, decomposing organic matter such as rotting fruit and vegetables and animal manure, but usually do not affect people. It is not transmitted between people, which is, to me, because I never really looked it up. My wife always did. Of course, she looked everything up. She was, I was just trying to survive. But while I was in there, they were saying it is a very contagious disease. So I'm trying to figure it out here. They say it's very contagious. You don't want to touch it. It can get in your fingers and all of this stuff. But on here, it's saying that it's not transmitted between people. We'll have to dig deeper into that in a later video. This isn't the video for that, I guess. Risk factors include diabetes with persistently high blood sugar levels, or diabetic ketoacidosis, low white blood cells, cancer, organ transplant, iron overload, kidney problems, long-term steroids, or use of immunosuppressants, and to a lesser extent in HIV and AIDS. Now I will say this, I had been diagnosed with diabetes before, but I got on a workout regimen, I started eating right, and my blood sugars were good, my blood pressure was good, so don't think that had anything to do with it. But like I said, we'll come back to that type of stuff at a later day. Right now, I just want to kind of introduce you guys to what it is that debilitated me. Diagnosis is by biopsy and culture with medical imaging to help determine the extent of disease. It may appear similar to aspergillosis. Treatment is generally with amphotericin B and surgical debridement. The surgical debridement. I had over 40 surgical debridements, my back and my head, total. So it seemed like they were debriding my back every other day. It was really bad in my back. And debridement is basically, let me click on it and see if I'll give you the true definition to it. It's basically like cutting stuff out. You know, it's crazy. So it says debridement is the medical removal of dead, damaged, or infected tissue to improve the healing potential of the remaining healthy tissues. Removal may be surgical, mechanical, chemical, autolytic, self-digestion, and by maggot therapy. So for mine, it's they basically were just cutting it out. You know, they call it a debridement. That's the medical term for it. They were basically just cutting it out of my back, cutting it out of my back. I've already shown you guys the top of my head. Clearly, you know, my picture for my channel is the top of my head. You guys will see my back also. Basically, the top of my head was cut down to my skull. And then my back was cut all the way down into my spine. So that's what debridement is. And like I said, I had over 40 debridements, surgical debridements for my back and my head. Preventive measures include wearing a face mask in dusty areas, avoiding contact with water-damaged buildings, and protecting the skin from exposure to soil, such as when gardening or certain outdoor work. It tends to progress rapidly and is fatal in about half of sinus cases and almost all cases of the widespread type. So when they say it's fatal in almost all cases of the widespread type, while in the hospital, once they figured out what was wrong with me, and I kind of go into detail on, you know, exactly how all this stuff was figured out a little later, but once they figured out that, you know, this is what was, you know, paining my back, basically the doctor came in and told me it's a 97% mortality rate. You have a 3% chance to live. Not in so many words, you know, looked at me and my wife and was like, you might want to get your, you know, affairs in order. So it was found in my back first. And I'll have to get the stuff from my wife. My wife did an amazing job. She took pictures, she kept notes, she's time-stamped, dated everything. And we'll get into all of that in later videos. But it was caught in my back first, and maybe 3 weeks later, 2 or 3 weeks later, maybe even longer, I don't know, I'll have to go back in and look. Then it was discovered in my head. So their thing was, if it reaches my spine, there's nothing they can do. If it reaches my skull, there's nothing they can do. You know, I'm going to go. Okay. So let's keep going here, because like I said, the stories are going to come. Mucormycosis is usually rare, affecting fewer than 2 people per million people each year in San Francisco. I'm not in San Francisco. I'm in Oklahoma. But is now 80 times more common in India. Once again, I'm not in India. People of any age may be affected, including premature infants. The first known case of mucormycosis was possibly the one described by Friedrich Kuchenmeister in 1855. The disease has been reported in natural disasters, 2004 Indian Ocean tsunami, and the 2011 Missouri tornado. During the COVID-19 pandemic, an association between mucormycosis and COVID-19 has been reported. Excuse me. This association is thought to relate to reduced immune function during the course of the illness and may also be related to glucocorticoid therapy for COVID-19. A rise in cases was particularly noted in India. So that's the Wikipedia. And like I said, I'll go to WebMD. We'll do more videos of trying to get as many, I guess, definitions or, explanations of what this disease is, what it does, what it causes, how it works. But basically, like I said, it was found in my back first, then found at the top of my head. The top of my head that you guys see is fake. I cannot feel it. It itches because I have, I guess, nerve endings in there that are trying to, my back itches a lot because of nerve endings trying to reform and stuff like that. But the top of my head is fake. And I'm going to show you something really fast. I don't know how well you can see right here. See if I can get it there. Right here is where I bumped my head on my car, the trunk of my car. So what'll happen is, I'll hit my head sometimes. I never really notice it because, like I said, I cannot feel this. There's no feeling in this. It's fake. If you can see here, the skin here is where they tried to do a skin graft, but it didn't take all over the head. It only took in certain little places. Anyways, we'll get into more of that, stuff a little later. This is still basically just, another introduction video, what I'm going through. Like I said, don't ever let someone tell you you cannot live a fulfilling life because of whatever condition you may have. No matter what that condition is, I don't care what your age is, you can always live a fulfilling life. And let's never forget, stranger than fiction family, that whatever doesn't kill you simply makes you stranger.